Welcome to the Deep Dive. Today we're plunging into a topic that honestly impacts every single one of us. The incredible complexity of family dynamics. We're going to explore how we can support families through their trickiest moments, revealing some, truly surprising insights along the way.
That's right. As maybe your shortcut to understanding family therapy techniques.
Okay.
Our mission is basically to unpack the core definitions, the vastly different approaches, and, those unexpected nuggets of wisdom about how family therapy helps entire systems adapt and ultimately thrive.
Right.
We're talking about a specialized type of psychotherapy that might nuclear family members, step-family dynamics, or sometimes even extended relatives, all working together over multiple sessions to tackle issues that interfere with a family's day-to-day functioning and the home environment.
And it's so important to remember just how varied families can be, isn't it?
Absolutely.
I mean, they come in every structure, makeup size, with unique rules, even their own unspoken language sometimes.
Yeah.
A skilled therapist doesn't just treat an individual. They kind of immerse themselves in these unique family ecosystems, always keeping cultural factors and those deep, often invisible, multi-generational patterns in mind. It's really never a one-size-fits-all situation.
And the ability to see and respect that nuance is absolutely critical.
So when a family steps into this kind of therapy, what are they actually trying to achieve? What's the ultimate mission for the families seeking help?
Well, at its core, family therapy aims to open up and improve communication channels. That's a big one.
Okay.
It's about shifting rigid roles, rules, or even secret alliances that might be causing friction.
Right, those hidden dynamics.
Exactly. Therapists will often model healthier behaviors, educate family members about their patterns, and help dispel myths that might be holding them back,
Yeah.
You're ultimately strengthening the entire family system, helping them navigate challenging situations, encouraging independence and individuality among members, and crucially, fortifying the relationship between parents if they're present.
Okay.
All of this kind of culminates in finding concrete solutions to family problems and making the home environment a more supportive place.
That makes so much sense. So when should someone consider this kind of treatment? Are there areas where it really shines?
Definitely. It's often incredibly valuable when a family member is dealing with a serious physical or mental illness.
Right.
Therapy helps educate the whole family, allowing them to work out care problems and navigate the emotional landscape together. It's also frequently applied when children or adolescents have personality, anxiety, or mood disorders that are impacting their family or social life.
Yeah, I can see that.
Another common scenario is navigating the complexities of a new step-family, or for families with mixed racial, cultural, religious backgrounds, where differing parenting styles or expectations can create tension.
Okay, that gives us a fantastic overview. Now, let's unpack some of the truly fascinating and distinct approaches within family therapy.
Yeah, let's do it.
We're going to really deep dive into Bowenian, structural, strategic, and solution-focused brief treatment. Each offers a unique lens and sometimes, a completely counterintuitive path to healing.
Let's start with Bowenian family therapy, produced by Murray Bowen. Its essence lies in balancing two fundamental human forces, the drive for togetherness and the need for individuality.
That push and pull. So if there's too much togetherness, what happens?
Well, Bowen believed too much togetherness leads to what he called fusion, where individuals merge, preventing people from developing their own clear sense of self.
Okay, like losing yourself in the family.
Exactly. Conversely, too much individuality can lead to a distant, estranged family. The sweet spot, the healthy place, is where family members are differentiated.
Differentiated.
Meaning they can maintain their individuality while still being emotionally connected, experienced in the family system.
That's such a powerful idea, that the system's anxiety can actually impact individual well-being. And the core of this seems to be something called differentiation of self.
That's absolutely foundational. Yeah. Differentiation of self refers to an individual's ability to maintain their own thoughts, feelings, and identity, even when emotional intensity of the group, or groupthink, as you put it earlier.
Right.
The less differentiated a person is, the more easily others influence them, and often the more they try to control others. While we have, inborn predispositions, our childhood and adolescent family relationships largely determine how differentiated we become. And here's the kicker. Established, this level rarely changes without really structured long-term effort.
Wow.
It's almost like an internal thermostat that's been set.
That's a powerful metaphor. It brings to mind this case example, Mark, a 21-year-old in liberal arts college. His parents were both doctors, right? And they've always pushed him towards medical school. Mark's been procrastinating on things like the MSAT, family arguments. Now he's experiencing anxiety, poor sleep, and his school performance is slipping. How would a Bowenian therapist approach Mark's case through this lens of differentiation of self? What's really going on beneath the surface of his procrastination from this perspective?
Right. So a Bowenian therapist would see Mark's procrastination not just as his individual problems, but as symptoms of low differentiation within his family system.
Oh, okay.
He's struggling to define his own identity and desires separate from his parents' powerful expectations. The anxiety he feels is a manifestation of that fusion, that lack of separation.
Got it.
The therapy wouldn't focus but on coaching Mark to increase his own differentiation. It's about him defining what he wants for his life and learning to resist that intense togetherness force.
So helping him find his own voice.
Exactly. This would involve helping him use I statements and truly understand his unique role in the family's emotional dance,
Fascinating. It sounds quite dramatic. Triangulation.
It can be, yeah. Triangulation is when a third person is brought into a two-person relationship, a dyad to manage excessive intimacy, conflict, or distance.
Okay.
Bowen saw it as a way to diffuse or reduce anxiety in that original two-person relationship and across three people. It's often an unconscious process.
We had that example of Jeanette and Tim, married 7 years. Tim complained that after every argument, Jeanette immediately called her mother, Barbara, to vent.
Classic example.
Tim felt uncomfortable around Barbara now, believing she had a negative opinion of him, and felt it made it harder for him and Jeanette to work. Jeanette, however, insisted she needed her mother's input to resolve her feelings and avoid depression impacting their marriage.
Right.
From a Bowenian perspective, this is a textbook example of triangulation. What's the therapist's first move here?
Well, the therapist's absolute first job is to avoid being pulled into that triangle themselves. That's crucial.
Okay, don't be...
Exactly. Bowen would then work to help Jeanette and Tim detriangulate. That means helping them learn to resolve their conflicts directly with each other without involving Barbara.
Right, keep it between them.
Yeah. Jeanette would be coached to manage her own anxiety and emotional reactions without needing her mother to regulate them for her. This ultimately strengthens the making it more resilient.
So the main goal of Bowenian therapy is really to reduce that chronic underlying family anxiety by helping everyone become more aware of how their emotional system operates and then to increase their individual differentiation. It's all about self-change, not trying to force others to change.
Precisely. The folds and stages.
Yeah.
Initially, it's about reducing the immediate anxiety by understanding how the symptom fits into existing relational patterns.
Okay.
Then, for adult clients, the focus shifts to internal self-issues to boost their differentiation, helping them resist that pull toward fusion. In later stages, the coaching often extends differentiating from their family of origin with the belief that gains here will naturally ripple into decreased anxiety and greater self-responsibility in their current nuclear family.
What are some of the practical tools Bowenian therapists use, like in the room?
They frequently use genograms, which are like family trees but mapping emotional patterns. Very insightful.
Oh, interesting.
Process questions help family members reflect on their roles and interactions, prompting them to think rather than just react emotionally. They might use relationship experiments or even role play to help families try out new ways of interacting safely. And crucially, teaching I statements empowers individuals to express their thoughts without resorting to blame.
That sounds really important.
Yeah. The therapist's role is often neutral, acting more as a coach and educator. The overarching goals are to increase differentiation, reduce emotional reactivity, help individuals detriangulate from their family of origin, reframe the presenting problem as a multi-generational pin-up, closed family ties, and of course, educate the family about these systemic patterns.
Let's apply this to the Smith family example again. Tanya, the 16-year-old daughter, hospitalized for self-injurious behavior and suicidal thoughts. The family was kind of peripheral, but now they're intensely reactive.
Right.
Tanya blaming her father about lack of progress, her 19-year-old sister questioning Tanya. How would a Bowenian approach guide the intervention here?
Okay, so a Bowenian therapist would hone in on the family's overall anxiety first, exploring the fears and concerns of each member and the system itself, always encouraging I statement.
Adapting everyone's perspective.
Exactly. They dive into current nuclear facts and changes while also mapping out existing triangulations and assessing how fused or differentiated family members are. For Tanya, they might ask something like, Tanya, I know you've become incredibly skilled at expressing your parents' emotions, but just for a moment, what would you say for your own needs?
shifting the focus.
And to the parents, maybe, of when you first started taking Tanya's symptoms so personally, the therapy might expand to previous generations, connecting current challenges to long-standing multi-generational themes.
Wow, really zooming out.
Yeah, even using role plays to help the family really see their system in action. Ultimately, the goal would be to help Tanya differentiate her sense of self, read triangles, and educate the entire family on their patterns, empowering them to make changes that reduce anxiety and foster greater health.
It sounds incredibly thorough, but I've heard some critiques of the Bowenian model. Are there any drawbacks?
Yeah, there are. One common criticism is that its broad systemic focus can sometimes feel clients who are primarily seeking quick relief for a specific symptom within their nuclear family. They might feel like, why are we talking about my grandparents?
Right, just fix this problem.
Exactly. Also, some have observed that early Bowenian thinking, like other pioneering family therapy models, sometimes gave maybe disproportionate attention to the mother's role in a child's...
Okay.
And finally, because of its emphasis on rational and objective processes, some feel it can sometimes relegate direct emotional expression to a lower priority when that might be exactly what a family needs to process.
Okay, that makes sense. Now let's shift gears completely and explore structural family therapy, or SFT. This approach is strongly associated with Salvador Minuchin, and it sounds very action-oriented.
It absolutely is. Structural therapy's core focus is on observing and then adjusting the family system itself. It's all about ensuring the parents are genuinely in control and that both children and adults have clear, appropriate boundaries.
Boundaries seem key here.
He actually joins the family, stepping right into their world to observe their interactions firsthand, learn their rules, and then guide them to strengthen their relationships. The key element, as you said, is indeed boundaries.
Minuchin had 3 core axioms for SFT, right?
Yes, that's right. First, an individual's emotional functioning isn't just an internal, constantly influenced by and influences the family context through recurring interactions.
So context matters.
Big time. Second, when the family structure changes, it directly leads to changes in individual behavior and internal psychological processes. Structure influences function.
Okay.
And third, when a therapist joins a family, the therapeutic system is formed one that has a greater capacity for change than the family did on its own.
Right. The therapist becomes part of the system temporarily.
Exactly. So you can see how central family structure, family subsystems, and especially boundaries are to this approach.
Tell us more about these boundaries in SFT. How do they work? Are they like physical walls?
Not physical walls, but participates and how in family interactions. They range from rigid, which can lead to emotional disengagement. Imagine walls so thick nobody truly connects. Very isolating. On the other end, you have diffuse boundaries, which lead to enmeshment where there are barely any walls at all, and everything spills over, making individuality difficult and everyone else's business.
I see. No personal space.
Right. Healthy or clear boundaries are the sweet spot. They're flexible enough to allow for close connection and support, but firm enough to allow for independence and privacy. Minuchin famously said, "In all cultures, the family imprints its members with selfhood. Humanity has 2 elements, a sense of belonging and a sense of being separate. Clear boundaries are how that balance is achieved."
This definitely sounds like a therapy of action, as you called it.
It truly is. The goal of SFT is to make the family more adaptive and functional. What's interesting is that Minuchin believed deep psychological insight isn't essential for change to occur.
Really?
Yeah. The emphasis is squarely on modifying the present interactions, not endlessly exploring the past. The therapist joins the family system in the moment and actively uses their presence to transform it, focusing on modifying the family structure right there within the session.
So how does this action-oriented process unfold? Key steps in SFT.
There are 3 main steps. First, the therapist joins the family system. This means immersing themselves, establishing that genuine connection. It's crucial.
Okay.
Second, they conceptualize or diagnose the family's underlying structure, not a diagnosis of an individual, remember, but of the interaction patterns.
Right, the system's diagnosed.
And third, they restructure the family system, creating situations in session to shift those dynamics. That's the action part.
Let's zoom in on that first step, joining the family system. It sounds like a delicate dance.
It absolutely is. Joining is about building rapport, making family members feel comfortable, respected, and truly heard. That's a neutral observer. They actively accommodate their own behavior to match the family style, their unspoken hierarchy, and their rules.
So they adapt to the family.
Yes, but it's a critical balance, adapting to relate to the family while still maintaining a clear position of leadership within the therapeutic setting.
That sounds incredibly challenging, especially if the therapist is very different from the families.
Yeah.
Let's think about Sally, a middle-aged Caucasian therapist. She's naturally soft-spoken, professional, calm, avoids strong emotions.
Okay.
She gets referred a young Hispanic family whose communication style is, say, loud, quite expressive with their hands, maybe involves playful cursing and merciless teasing.
Gee.
Totally.
Yeah.
What behaviors could Sally genuinely adopt to join with this family? How difficult might that actually be for her?
That's a fantastic scenario. It highlights the challenge. Sally could use specific techniques like maintenance by temporarily supporting the family's existing structure just to reduce their initial anxiety about therapy. She could try tracking by asking clarifying questions and really following their emotional and verbal communication threads, showing she's listening intently. Mimesis would involve subtly copying their communication style, maybe mirroring their body language, or even a bit of their expressive verbal style if it feels authentic for her. That's the key.
Right.
She could openly enjoy their humor, express genuine affection if appropriate, and offer praise using a strengths-based approach. But yes, this would be incredibly difficult for Sally because it requires her to step far outside her comfort zone. It's essential for building that crucial bridge of connection and trust, though.
Okay, so once joined, the next in the family, or what you call diagnosis in SFT. How is that different from diagnosing an individual again?
Right. So in SFT, diagnosis isn't about an individual's internal state. It's about understanding the process or pattern that gives rise to the symptomatic behavior. There are 4 key areas they look at.
4 areas.
Okay. First, organization. Charge. What are the subsystems like? Are parents a unit? Siblings a unit? How does communication flow? Is it direct or indirect? Indirect often leads to confusion.
Makes sense.
Second, resonance. This is the degree of emotional closeness. Is it high resonance, meaning enmeshment with those permeable boundaries, where individuality is low resonance, with rigid boundaries and emotional distance? The therapist assesses if these patterns are causing problems, considering cultural context, too.
Got it. What are the other 2?
Third, life context. What are the external sources of support or stress, extended family, community, work, school, and what developmental stage is the family in? Are parents acting as caregivers appropriate?
Picture.
Yeah. And finally, the identified client, or the person with the symptom. How are their symptoms being used, maybe unconsciously, to maintain existing interaction patterns? And how much blame is being placed? The therapist's job is to alter not just the problem behavior, but how all family members relate.
And the specific technique used here is a family map, which sounds distinct from a genogram we discussed earlier.
It is. A family map is a specialized technique needing specific training. Unlike a genogram showing lineage, it visually represents the family structure right now, including boundaries, rigid, clear, diffuse, subsystems, conflicts, and the specific intrafamily dynamics, plus those external stressors. It's a dynamic visual diagnostic tool.
Very cool. So after joining and conceptualizing, we get to step 3. Restructuring the family system. This is where the action really takes center stage.
This is where the therapist actively intervenes, yeah. Restructuring operations encourage the family to challenge themselves by respond to each other in the session.
How do they do that?
Techniques can include having the family enact transactional patterns, meaning instead of just describing an argument, they're asked to have it right there in the room.
Wow. Live action.
Yeah, with the therapist observing and guiding. The therapist might push them to talk directly to each other instead of always talking to the therapist. Leading the physical space, like moving seating arrangements, can be a powerful intervention. And, of course, actively marking boundaries, shifting them within or between subsystems.
What other restructuring techniques are used? Are there more?
Oh, yeah. Therapists might escalate stress in a controlled way to observe and then restructure coping style. Block usual transactional patterns to nudge the family into trying different ones, or allow an implicit conflict to develop and play out, rather than diffusing it too quickly. Assigning tasks, either in session or as homework, is very common.
Like homework assignments.
Exactly, like changing seating at the dinner table or setting up specific check-in meetings in a respectful and honest way is key, shifting the family's perspective. Unbalancing involves the therapist briefly siding with one subgroup or individual to break an impasse. And psychoeducation, teaching communication, anger management, or conflict resolution skills to the whole family is another important tool.
Let's bring back Tanya, 16, hospitalized, family reactive. How would an SFT approach guide the intervention differently from Bowenian?
Okay, a structural therapist would likely begin by physically shifting boundaries in the room. They might have the parents sit together, creating a strong parental subsystem, and ensure Tanya and her 19-year-old sister sit next to each other, a supportive sibling subsystem.
Changing the physical setup first.
Right. Then, crucially, they would encourage each family member to discuss their experience of Tanya's hospitalization with each other, not just to the therapist. This immediately shifts the communication dynamic.
Direct interaction.
Yes. Tanya's hospitalization could be powerfully reframed as an act of her parents' changing its perception from blame to support. Psychoeducation on appropriate ways to care for and respond would be provided to the whole family, and specific homework would be assigned to increase healthy communication at home, perhaps a family meeting, ritual, or specific tasks to reinforce new boundaries.
What are the myths that have been leveled against structural family therapy? Does it have downsides?
It does. Some therapists find the joining stage uncomfortable, worrying it can feel inauthentic for both sides if not done skillfully.
Yeah, that mimesis thing could feel tricky.
Exactly. There's also the view that SFT might focus too much on generational differences, like parent-child issues, and not in the same generation, like sibling dynamics or spousal issues.
And what about emotions? You mentioned that with Bowenian.
Right. Similar critique here. Some argue it might focus too much on observable boundaries and structure, and less on directly processing complex emotional lives. Additionally, concerns have been raised that it might inherently lean towards of the nuclear family structure, potentially lacking sufficient cross-cultural consideration in its application.
Important point.
And there's also some debate about the use of confrontation and its potential impact on the therapeutic alliance, if not handled very carefully.
Okay. Now let's turn our attention to strategic family therapy, often associated with JANs. This one sounds even more brief and directive than structural.
It absolutely is. In strategic FT, the therapist is in a clear position of power. The therapy is often quite brief, maybe 8-16 sessions, and it frequently involves assigning specific homework tasks.
Homework, yeah.
Yeah. Communication is paramount, and the therapist is far more active, probing. Haley himself defines strategic as the therapist initiating what happens, designing a unique, specific approach for each problem, and taking responsibility for directly influencing people.
Taking responsibility for influence. Interesting.
Yeah. It has roots in structural family therapy and builds on communication theory, making it active, brief, directed, and very task-oriented.
So it shares some core tenets with structural FT then. Quite a few.
Many, yes. Both see family members acting within a larger social context. Both consider the family life cycle and developmental stage crucial for understanding problems. They both heavily focus on the present, not the past. Both are system-oriented, as to has a clear plan. They are process-focused, not content-focused, meaning how the family interacts is more important than what they talk about. Diagnosis often emerges through the intervention, not before it. And interpretations are often designed to relabel something, to shift perspective, rather than purely to produce insight. Tasks are also frequently used in both.
But there are distinct differences too, right? You mentioned the therapist's role is different.
Crucial differences, yes. Strategic family therapy places significantly less emphasis on physical boundaries compared to structural therapy. Structural is really about leadership and establishing stronger boundaries.
Okay.
Instead, strategic therapy is influencing the family to move out of recurring, unhelpful, circular patterns of communication or interaction via direct, active problem solving.
Influencing them out of the rut.
Exactly. The therapist takes a much more direct role in orchestrating change and isn't afraid to use more unconventional or even paradoxical strategies.
What are the core of strategic FT? They sound quite unique.
They are. Strategic therapy assumes that while people might resist change, they are always communicating, even through their symptoms.
Everything is communication.
Everything. All messages have a report, the content, and a command, the implied instruction about the relationship. The focus is heavily on the commands. Are seen as messages, often unconsciously helping the system survive, almost like a strange form of family loyalty. It's only a problem if the family defines it as such. A fascinating assumption is that family members often inadvertently perpetuate problems by their own solutions.
Trying to fix it makes it worse.
Sometimes, yeah. So the problem is the maintenance of that symptom. Finally, they believe that specific direct directives can bring about sudden, decisive change. Key motivations for family members are often seen as either power or love.
So individual problems are viewed as symptoms of a dysfunctional system. The goal isn't necessarily to create some idealized healthy family. Design interventions that help the family effectively handle its current developmental tasks.
Exactly right. The process generally involves a social stage for rapport building, then inquiring for specific problem information, followed by observing the family interacting directly with each other, and finally setting clear, specific, measurable goals, SMART goals.
Used in strategic FT are famously distinct, maybe even controversial.
They certainly are. Positive connotation is used, similar to reframing, to alter how a problematic behavior is viewed, making it seem less negative, maybe even having a protective function.
Okay.
Directives are straightforward instructions or homework assignments. Covert, subtle suggestions or indirect feedback, praising desired behavior, ignoring non-desired.
Subtle nudges.
Yeah. The most talked about, and sometimes controversial, are paradoxical interventions. These might involve prescribing the symptom, for instance, telling someone to worry more or to have a particular symptom on schedule.
Wait, telling them to do the problem behavior.
The idea is to reduce resistance by making the unhelpful behavior conscious or voluntary, or by leading the family to react against the directive. It's like reverse psychology, but more complex. These must be done with extreme care and professional supervision.
I can imagine. Wow.
Other techniques include pretend techniques, if something is different, asking what would happen if, hypotheticals, and the therapist maintaining neutrality by not aligning with any specific family member.
Let's consider Landon, the 10-year-old avoiding school, spending all his time with his mother, who has medical issues. The therapist, John, assesses poor boundaries, wants Landon to improve them. John spends time with adults and Landon to join after-school activities. What kind of intervention is John using here?
Okay, John's initial intervention, encouraging mom to spend time with adults and Landon with peers, is a clear directive. It's a direct instruction aimed at shifting their behavior and strengthening boundaries. Simple enough.
Right. Now, pushing the envelope a bit, if John instead spend all their time together, like really double down on it, what type of intervention would that be, and how could it potentially help?
Okay. If John encouraged them to spend all their time together to intensify the behavior, that would be a paradoxical intervention.
Prescribing the symptom.
Exactly. The underlying idea is that by prescribing the very symptoms, it makes the unhealthiness of the behavior so obvious or burdensome that the family recognizes it and reduces it on their own. Or they rebel against the instruction. It's a way to disrupt the pattern by exaggerating it, often leading to a natural pushback against the problem itself.
That's counterintuitive, but potentially powerful. In terms of strategic FT, it sounds like it walks a fine line.
It definitely requires immense skill and ethical consideration. One primary concern stems from the nature of some interventions, particularly the paradoxical ones, as they can be perceived as manipulative.
Yeah, I can see that.
Therapists need to be extremely careful to ensure these are used appropriately, professionals with a robust supervision, because if not done carefully, they could potentially be counterproductive or harmful. It's not something to try lightly.
This leads us nicely to brief strategic family therapy, BSFT. How does it fit in, and how does it differ from traditional strategic FT? Is it just shorter?
Not just shorter, though it is brief, is that in brief strategic family therapy, the therapist is slightly less central to the solution. The focus shifts even more directly to working with and changing the family member's own communication patterns in the room.
So more focus on their interaction.
Exactly. The main skills employed are tracking, identifying both family strength and maladaptive patterns you want to encourage, blocking those you want to change, and of course, reframing. Videotaping sessions is also frequently used for review, supervision, and planning the next session, allowing for really precise observation of those patterns.
And the role of reframing in BSFT seems particularly vital here, too.
It is absolutely fundamental. The core principle is that family's perception of a problem or a behavior. That changed perception will then naturally lead to a change in action.
Perception changes action.
Right. For example, back to Tanya's case, if her hospitalization was reframed as a profound act of love and care from her parents, the therapist would then crucially check if that reframing held true. Did it genuinely resonate with them? Did they truly buy into that new perspective? Because if it didn't, it wouldn't effectively lead to the desired change in their interactions. You have to see if the reframe sticks.
Okay, makes sense. Let's shift gears now to our last major model, solution-focused brief treatment, SFBT. The name itself signals
It does, and it truly is. SFBT operates on several core assumptions that really set it apart. First, clients want to change. Second, there's no such thing as resistance. Rather, clients are simply telling us how they are willing to cooperate.
No resistance. That's radical.
It is. The focus is almost exclusively on the present and future, past, except maybe to uncover exceptions to the problem.
Exceptions?
Yeah, times when the problem wasn't happening. The aim is to shift from problem talk to solution talk, believing that the language we use actively shapes our reality. The therapist-client relationship is absolutely central, but there's really no interest in pattern.
So it's not really focused on why the problem started at all.
Precisely. They believe solutions aren't necessarily directly related to the problems themselves. It strongly emphasizes that the client already possesses strengths and resources, and the therapist's role is to amplify hope, often acting as a cheerleader.
The cheerleader effect.
Yeah. They fundamentally believe that it can snowball into much bigger changes, and that the problem is never happening all the time. There are always moments or exceptions when it's absent or less severe. Finding those exceptions is key.
What are the main goals in SFBT? What are they aiming for?
The goals are very pragmatic and forward-looking. Basically, to help clients think or do things to their life satisfaction. They work towards clients' good enough goals, modest, clear, and specific outcomes, not necessarily total transformation.
Good enough. I like that.
Yeah. Therapists help translate these broad goals into specific, actionable steps and guide clients to shift their language from problem focus to...
And what kinds of interventions do they use to achieve that? It sounds very different.
They employ several unique tools. Problem-free talk encourages discussion about areas of life where the problem isn't present, building confidence and reminding them of competence.
Focusing on the positive.
Exactly. The famous miracle question asks clients to imagine what life would be like if the problem disappeared over. What's the first thing they'd notice? It sparks future-oriented thinking.
Ah, the miracle question. Heard of that.
Yeah. Exception questions explore times when the problem didn't happen or was less severe, highlighting existing coping mechanisms they might not recognize. Coping questions acknowledge the client's resilience, like, wow, how have you managed to cope this far? Solution.
Recognizing strength.
Yes. Scaling questions invite clients to rate their progress or feelings on a scale of 1 to 10, making abstract concepts concrete and measurable. They might also use a timeout for reflection, provide genuine accolades for strengths observed, and assign specific tasks geared towards solutions.
Any criticism, it sounds so relentlessly positive. Does that ever backfire?
It is very positive, and yes, it has faced critiques. Due to its strong focus on solutions and the minimization of maybe deep emotional discussion, some clients can perceive the therapist as somewhat insensitive, especially if they feel their pain isn't being fully acknowledged.
Like they're being rushed past their feelings.
Yeah. This style can also be quite counterintuitive for many providers, as it requires a very specific, future-oriented focus, and it consciously avoids exploring other potentially contributing historical or emotional factors. And finally, the genuine need for an authentic, strength-based approach and providing accolades can be challenging with the clients well enough to genuinely offer that praise. It can fall flat if it feels forced.
Okay. Finally, let's talk about an essential but often difficult aspect of therapy. Dealing with non-compliant, resistant, and what can feel like difficult families. This is where the rubber meets the road, right? Therapy requires collaboration.
It truly does, and the understanding the why. There are countless reasons why families or individuals might resist therapy or engagement, and these reasons are always highly individualized. Taking the time to truly understand their specific concerns makes an enormous difference.
So don't just label them resistant.
Exactly. Instead of debating or negotiating when resistance shows up, a skilled practice signal to change their approach, perhaps by focusing discussion on different aspects or by reframing the resistance itself. They might simply reflect back the resistance, I hear you're hesitant about this, or use double-sided reflection to acknowledge both their concerns and the desire for change, however small.
This reminds me of Arthur. Remember him? Son, AJ, and AJ's mother have been in therapy, but Arthur, the father, hasn't been involved. He's seen as a problem due to his anger and a belief that therapy is useless.
Right, the reluctant dad.
You managed to get Arthur to agree to come to a session, but he presents just as described.
Yeah.
Irritable mood, poor eye contact, non-responsive, even hostile. How do you even begin with Arthur? What's the very first step?
Oh, boy. Okay, the very first step is to acknowledge Arthur's late involvement. Just name it. Ask if it was truly his choice to come, and acknowledge that joining a process already underway can be difficult and maybe feel awkward.
Validate his position.
Yes. It's crucial for therapists not to unconsciously reinforce traditional gender, allow the mother to be the sole gatekeeper of information or problem definition. Arthur's perspective is just as valid, and his role in AJ's development is absolutely key.
So bring him into the fold.
Right. The therapist might ask him directly, who do you want your son to be? Or, do you have any concerns about how therapy might interfere with your family or your son's future? Vital not to defend the treatment, the agency, or prior decisions. Just listen. And perhaps most critically, remaining calm when you are the target of anger is paramount for building any kind of alliance. Don't get defensive.
So beyond that first step, what are some specific recommendations for working through these really challenging dynamics?
Well, first, consistently communicate respectfully. That sounds obvious, but it builds trust, fosters honesty, and helps the family feel safe. Work towards mutually agreed upon goals from the start, even if they're small.
Find common ground.
Yes. Understand the parent's needs, and if appropriate, provide practical assistance or referrals. Be reliable and available return calls, crystal clear about your role and your responsibilities, including legal and ethical ones.
Clarity is key.
And be clear about boundaries and acceptable behavior in the room. It's absolutely okay to stop conversations when they become unsafe, and importantly, to model how anger can be expressed in a safe, constructive way.
And when genuine hostility surfaces, therapists skillfully respond without escalating things.
Right. First, be prepared for it. It happens. And self-reflect quickly. Did you, as the therapist, inadvertently aggravate the situation by becoming angry yourself, patronizing, or dismissive? Own your part if necessary.
Take responsibility.
Yes. Accept that hostility is often a response to frustration, whether it's related to the therapy session or something completely unrelated. Acknowledge that the parent has a need to complain, and maybe they have very good reason to. Just listen.
Hear them out.
But always monitor for deliberately threatening, obstructive, abusive, or violent behavior, and be ready to set clear limits immediately. Safety first. Check of the impact they're having, or if they're simply used to aggression and don't appreciate its effect on others. Finally, ensure your own discomfort isn't disproportionate, and try not to take it personally if the hostility is aimed at the agency or the situation, rather than you specifically.
That's incredibly insightful advice. Now, to help families navigate themselves, especially anger, what are some practical fair fighting rules that can be taught and reinforced in therapy? Things they can use at home.
Yeah, these are simple but really powerful for de-escalating conflict. First, encourage everyone to ask themselves why they feel upset before they even start talking. Take a breath.
Identify the feeling.
Right. Second, discuss only one topic at a time, overwhelmed or getting sidetracked. Third, be thoughtful about language. No degrading or name-calling. Basic respect. Exactly. Fourth, express feelings with words and take responsibility for those feelings using I statements, I feel hurt when. Fifth, take turns talking, actively listening to each other. No interrupting. Sixth, recognize that timeouts are incredibly useful tools and should be agreed upon and used when emotions run too high.
Okay, to take a break.
Absolutely essential sometimes. And finally, always attempt to come to a compromise or understanding, but also recognize that simply agreeing to disagree can be a valid resolution. Not every conflict needs a perfect solution.
Wow, what an incredible journey we've had today. We've moved from the intricate dance of togetherness and individuality in Bowenian therapy to the active sculpting of family structure and boundaries in Minuchin's work, through the direct, often surprising strategies aimed at breaking unhelpful patterns.
Right.
And finally, to the intensely positive approach of solution-focused brief treatment. What's truly fascinating here, if you think about it, is how each of these distinct approaches, with their unique philosophies and tools, all ultimately aim to help families find new, healthier, more adaptive ways of interacting.
Yeah, that's the common thread, isn't it? And this raises an important question for you, our listeners. Diverse ways families are defined and evolve in our modern world.
How might these therapeutic techniques not just address the immediate problems, but also actively build deep, lasting resilience within any family system, whether bound by blood, chase, or shared circumstance, to face life's ever unpredictable